Hello, I am Dr. B.V. Rao of Usha Clinic and founder of the website drraghavamedicaldoubts.in and qmedicaldoubts.blogspot.in. Today I am going to discuss about scoliosis. Scoliosis is a deformity of the spine characterized by the lateral curvature of the spine. Usually it is complicated by a rotational deformity which in thoracic region is transmitted to the ribs, producing a asymmetry of thorax. Hence, here scoliosis is accompanied with appearance of kyphosis called kyphoscoliosis. The causes of scoliosis. Congenital. It is due to congenital hemivertebra which in thoracic region is confined by coexisting congenital anomalies of associated ribs. Postural. Occurs in school-going age, presents with the C curve without rotation of vertebrae and is mobile and correctable, caused by incorrect sitting at the desk. The treatment is gymnastics and lessens the deportment standing in front of a mirror. Paralytic. This is due to the extensive paralysis of anterior poliomyelitis. The paralysis is so widespread that in addition to scoliosis, will have partial paralysis of both legs and can walk with crutches or double leg calipers. Treatment. The fitting of spinal brace may help to minimize the development of deformity. If erector spinae muscle is paralyzed completely, recovery is doubtful. Bed rest for prolonged periods is recommended. Spastic. It occurs following spasm of spinal muscles as syringomyelia. Fifth and the last is during treatment of empyema by prolonged drainage through tubes in the chest wall may cause scoliosis. Due to contractions of chest wall, nowadays it is rare due to thoracoplasties. Idiopathic scoliosis. The cause is uncertain but is presumed to be due to some neurological cause underlying it, as Friedreich's ataxia and von Wiechow-Gauss's disease, otherwise called neurofibromatosis, common in occurrence and severe as well. Early diagnosis and treatment are the fundamental aspects of this problem. Advanced deformity cannot be corrected, but the condition is presented only when the patient is about 10 years of age. Then it progresses fast till puberty. If diagnosed at this age, can do some hopeful treatment. Later progress is slow and the condition is irreversible. The deformity with severity may be corrected by orthopedic apparatus, after which the corrected position should be maintained by spinal fusion. The procedure includes, most widely used method is the wrist jacket. It is a plaster body cast including the head and one thigh, applied with the patient with the bent to the side of maximum correction, which can be tolerated. The cast is heavily padded with sorbo rubber at the essential points where the pressure is exerted. When the cast is dry, it is swan across at the level of apex of the primary curve and angulated by taking out wedges if necessary. The new position is held by means of metal hinges incorporated with the plaster to hold the two halves together. Correction will be very slow and can be checked by X-ray. When the primary curve is corrected, as far as surgeon thinks desirable, a hole is cut through the back of the plaster over the right of the scoliosis, and the operation of the spinal fusion is performed through this window. The bone used is taken as small chips from the patient's own tibia, and the volume can be increased by adding banked bone. In severe cases, the operation is performed in several stages so that a long length of spine is fused on both sides of the spinous process. After operation, 6 months are necessary for consolidation of the fusion, and another year of ordinary activities in carefully molded crochet is advisable so that the soft new graft is not subjected to severe bending strains. Milwaukee brace. This is an ambulatory splint applied to the trunk which carries an extension device to the head. It is used as a prophylactic method in mild cases or as a last splint after the spinal fusion. Internal jacking system. Attempts have been made to bury metallic screws, jacks, or compression springs to exert corrective forces directly on the affected spinal segments. Unilateral epiphysiotomy. Destroying the growing epiphyses at the affected segment of the spine on the convex border of the curve. This is all the correction of the scoliosis. In the next video, we will discuss about some other disease. Thank you.